What is postpartum anxiety and how is it different from postpartum depression? Hi, I'm Dr. Menije, a licensed psychologist here at Embracing You Therapy. Becoming a parent is a life-changing experience filled with joy, love, and excitement. But it's also a time of immense change and adjustment, which can bring about unexpected emotional challenges. While many have heard of postpartum depression, postpartum anxiety is less talked about, yet just as impactful. If you're a new mom struggling with persistent worry, racing thoughts, and overwhelming sense of dread, you might be experiencing postpartum anxiety. While postpartum anxiety and postpartum depression fall under the category of perinatal mood and anxiety disorders, they present in different ways. Postpartum depression is marked by persistent sadness, feelings of hopelessness, emotional numbness, and a disinterest in activities once enjoyed. Some moms with postpartum depression may struggle to bond with their baby and feel extremely guilty or ashamed, experiencing thoughts of self-harm. Now, postpartum anxiety is more about excessive worry, fear, and panic centered around baby's well-being. So the moms with postpartum anxiety constantly feel like they have to check if the baby is breathing, have intrusive thoughts of harm coming to their child, experience restlessness, and physical symptoms like nausea and dizziness and trouble sleeping. Now, here are 3 ways you can cope with postpartum anxiety. Number 1, practice mindfulness techniques. Anxiety is a different level of energy than depression. When you're anxious, you're jumpy and jittery and restless. So you really need to slow down your breathing, your heart rate, your thoughts to better regulate your nervous system. You can try deep breathing techniques, muscle relaxation, progressive muscle relaxation techniques to really help you regulate your nervous system and find ways to feel a little bit more grounded. Number 2 is to challenge your anxious thoughts. Now, when we're anxious, our perception of reality is skewed, meaning we don't see things as they are, we see them as we are. So if we're anxious, we see everything around us as dangerous, unsafe, we catastrophize things. So when you learn to challenge your thoughts, you want to first identify that you're having an anxious thought and find ways to reframe it, which you can work on in therapy. Number 3 is to seek support. You do not want to go through this alone. You want to connect with other people who understands your experience. So sometimes you might want to join a support group, or you want to work with a therapist one-on-one who understands postpartum mental health, and maybe even medication is a step to consider for what you're going through. We come a long way, but there's still lots of stigma and shame regarding postpartum struggles. And if it's untreated, postpartum anxiety can take a toll on your overall mental health. So please reach for support. If you have any questions, please share them with us and we will personally respond to you. And if you're interested in therapy, those in California, we offer therapy. So please reach out to us and I'll see you in the next episode.